Hello, everybody. Today we're going to be talking about the U.S. Trans Survey. And here we go. Perfect. Hello.
Hey, Paul. Nice to see you.
Nice to see you. So it looks like people have joined, so I'll go ahead and get started. So today we'll be talking about the U.S. Trans Survey, and we are joined by Britt. So during the COVID-19 pandemic, Whitman-Walker's Community Health Department has expanded its outreach efforts to the social media platform. We cover various topics about HIV, STI, sexual health practice, and access to care, and the community health team is here to educate and support you. So my name is Paul, and I use pronouns he, him, his.
And I'm Britt. I use they and them pronouns. Thanks for having me, Paul.
Of course. So thank you for joining us on the platform this evening. Today we will be talking about the U.S. Trans Survey, or the USTS, which is the largest survey of trans people in the United States. The USTS documents the lives and experiences of trans people in the U.S. and U.S. territories. And for today, we are going to be doing a Q&A about the survey. So I'm going to get started. What is the U.S. Trans Survey?
Yeah, so like you said, the U.S. Trans Survey is the largest survey of trans people in the United States, where we aim to document like the lives and experiences of trans people. In short, it's a survey, it's electronic, it's for all trans people age 16 and up. It's for people of all trans identities, including binary and non-binary trans folks. The US Trans Survey is also the main source of data about trans people for the media, educators, policymakers, and the general public. It covers health, employment, income, the criminal justice system, etc. These reports, the US Trans Survey reports, have been really vital resources, including the reports of the experiences of people of color and reports on state-by-state data. And actually, the most recent survey we have is from 2015, where nearly 28,000 trans folks in the US took the US Trans Survey, and it made it the largest survey of trans people in the United States to date. So we know a lot has happened since then, and it's time. It's been 7 years. It's time to do another US Trans Survey.
So who are the priority populations for the survey?
Great question. The folks who run the survey, that's the National Center for Trans Equality, they've identified that there are groups from the last time that were underrepresented, that they didn't have as much data from, and they've called those groups for this time the priority population. So for the 2022 survey, priority population trans folks are BIPOC trans folks, or Black and Indigenous people of color who are trans, older trans folks, which is anyone 45 years and up. You fit into the older trans folks category. Immigrants who are trans, whether you are documented or undocumented, trans folks living in rural communities. I think I got all the, am I frozen? Okay.
I think I was frozen.
Welcome back.
Thank you. So how many people take the survey? You said 28,000 in 2015. Do you have maybe a number for this year?
I do, at least the last time I was updated. The number that I'm going to share is based on the people who have pledged, the people who have said, I'm trans and I want to be counted. And at the last count, which was sometime in June, I think, there were over 27,000 trans folks who had pledged to completing this survey. I know that there are goals to surpass the count from last time. So we need some more people to pledge and we need more people to take the survey.
Perfect. When is the survey going to be released?
That's a little bit of a magical question. The timeline that we have from NCTE right now was that there were going to be some pilots to the actual survey in 2022 to kind of work out any technical bugs or kinks. So while they're still testing this product, it's a perfect time for everyone to pledge. If you're trans and you are looking for a way to respond right now, now is the timeline to pledge. We expect the survey itself to go live, I think, in the next few weeks, but it will only be open for a short period of time. So we're thinking it may be open for just like 2 to 3 weeks. And some of that depends on community response and how quickly folks are able to complete the survey. If you pledge, you do get notified once it's gone live. So there's some incentive to kind of connect now and you'll stay connected that way. And then once the survey is closed, the team at NCTE spends lots of time analyzing that data, cleaning up that data, and begin writing a report that all of us can utilize.
Perfect. So how can I or my organization work to support the success of the survey?
Yeah, I know the folks at NCTE would love any support. One of the ways to do that is by letting them know that you want to be involved. So there's a link available in their website where you can access what's called like a community organization involvement form. So if you are a part of an organization, you want palm cards, you want access to flyers, to advertise the survey to your community, that's one way to do it. They also include like an outreach kit where you can find a one-pager with lots of helpful scripts, for example, for social media, Instagram lives or Facebook posts. You can also make a pledge on behalf of your community. You can make a pledge for your organization. You can talk to trans people in your life about pledging for the survey. I already mentioned palm cards. You can also plan like a community event. Maybe you live in a rural area and you have access to the internet and you want to be able to support other trans folks in your community to access the internet and fill out the survey. Some people are hosting like survey completing parties, abiding by COVID and MPOX social distancing suggestions and all of that. But there are ways, to host a pledge drive or survey taking event as well.
Are there any individual organizations or events that you'd like to share with our audience that can promote the success of the survey?
Yeah, I know that Whitman-Walker is hoping to do more once we have the official survey dates. For now, I think sharing this live with your friends once it's on the platform and pledging yourself, sharing NCTE's digital media around the pledge. Those are the personal events that I would suggest folks take advantage of right now.
Perfect. And then lastly, what resources does Whitman-Walker offer to help support the transgender community?
Yeah, our resources are kind of varied and they look different during COVID time. Like you named, our community health team does a lot of health education and health promotion. We have HIV testing and counseling accessible to folks of all genders. Primary medical care is accessible for folks of all genders. We take a variety of insurance, including Medicaid from DC, Maryland, and Virginia. Asterisk there, only certain Maryland and Virginia Medicaids are accepted at Whitman-Walker, but we treat gender-affirming hormone therapy as a part of primary care. So someone who's interested in a medical intervention for their gender affirmation could become a medical patient at Whitman-Walker. Someone who may be interested in surgery support as part of their medical care can work with Whitman-Walker to have a trans care navigator and go through the process of getting mental health letters of support. We have some psychotherapy groups that are exclusively for trans folks, as well as peer support programs that are exclusively for trans folks. some research studies that are also exclusively for trans folks. So there are a variety of ways that someone might get some of their needs met by engaging in care at Whitman-Walker.
Perfect. So thank you so much for helping us learn about the survey. Um, we talked a little bit about testing today, so we just want to remind you that Whitman-Walker Health is open for free HIV and STI testing by appointment only, and you can schedule that by calling 202-797-4439. Do you have anything else that you'd like to add today about the survey or anything else?
I hope everyone goes to pledge to take the survey and shares that opportunity with their friends and community as well. I'm looking forward
Perfect.
to seeing what we have to say about ourselves.
And when we post this live, which will be today, we will include the link for that.
Thanks.
So I'm going to just give a few reminders about both COVID as well as Mpox. So before we go, we want to give you a few reminders about the COVID-19 and the vaccines. If you've already gotten vaccinated, congratulations. You've taken a really important step to preventing the virus from spreading. If you haven't been vaccinated and you're looking for an appointment, Whitman-Walker Health has the COVID-19 vaccines available, and you can reach out to 202-207-2480 to make an appointment. For DC residents, you can find information on COVID-19 vaccine walk-ups, locations, and eligibility by going to vaccinate.dc.gov. For Maryland, you can go to covidlink.maryland.gov or by calling 855-634-6829. And then for Virginia, you can schedule a vaccine appointment by going to vaccinate.virginia.gov. If you haven't been vaccinated and you're looking for an appointment, please continue to follow CDC guidelines for mask wearing, quarantining, and social distancing. It's very important that you consider getting the vaccine as well as discussing prevention methods and being mindful of those around you. So for Mpox, in DC, you can register for the monkeypox or Mpox vaccine appointment at dc.health.dc.gov/page/monkeypox. And you are currently eligible to be vaccinated in DC if you are a DC resident, you are gay, bisexual, and other men 18 years or older who have had sex with men or who have had multiple or anonymous sexual partners in the last 14 days, or if you are a sex worker, a transgender woman or non-binary person, or staff of any establishments where sexual activity occurs, such as bathhouses, saunas, and sex clubs. And then proof of residency is required, and this can be identification with a DC address, a utility bill, and or other mail or name and DC address. And then for Virginia, I'll just add this because we've gotten a lot of questions. For Virginia, it's the same qualifications, and you can call the health department, Fairfax County Health Department, to schedule an appointment. I actually did it yesterday, actually. They'll give you a quick survey through the phone asking different questions about eligibility. And I have mine scheduled for tomorrow. And I'll be going to the Fairfax County Government Center. They only have it Tuesdays or Thursdays. And then Tuesdays is out Mount Vernon. So if you do want to get scheduled in Virginia, that would be how you would do it. And then remember to follow us on Instagram. Well, obviously, you probably already are doing that. And then Facebook or Twitter. We also have a TikTok and a LinkedIn as well. So thank you so much for joining us today, Britt. And we wish you all health, happiness, and safety.
Thanks, 12. Take care.
Bye.